As we mentioned in pharmacokinetic, the process of pharmacokinetic includes absorptions when the drugs enter inside our body, distribution, how the drugs travels throughout the circulation, the metabolism that mainly occur in the liver, and the excretion that occur in different organs, but mainly in our kidneys. So, we mentioned we have two kidneys. The kidneys is the responsible organ that participate in this excretion. Other organs as the skin, breastfeeding or breast milk, the lungs, the sweating, allow that there's some substance, some drugs being eliminated through our body. But kidneys is the more responsible organ that participate in this process. We have two kidneys, and each kidneys have 1 million and 1.5 million in a healthy people, in non-elder people. In a young adult, healthy, have 1 million to 1.5 million of nephron, that is the functional part of the kidneys that producing urine. Remember that the kidneys have different functions as a remover of wasting products, creatinine, urea, nitrogen, the wasting products, our water also, participate in the production of blood cells, and also the absorption of calcium or calcium absorptions. The kidneys also participate in the balance of blood pressure and on the balance of mineral and water in our body. So we have two kidneys, and let me mention another important statistic. Here in the USA, 1 in 3 people, in 3 Americans, have chronic kidney disease, and many of them, 80%, don't know that have a chronic kidney disease. And 37 million of people have suffering from kidney chronic problem, almost renal failures, but they don't know, 80% don't know that have this problem. And 90,000 of Americans are waiting for a kidney or renal transplant. This important information may allow to keep in mind for nurses and health professionals and doctors, of course, that kidneys play an important role in our body, and for patients, for self-care, we should keep in mind the important aspect for the kidney functions. And for example, a lot of medication can affect the kidney function, the liver also, as aminoglycoside. Aminoglycoside is antibacterial medication, for example, gentamicin, that participate on the that is for gram-negative bacteria, and they produce nephrotoxicity, kidney damage. Other medications are ibuprofen, non-steroidal anti-inflammatory, ibuprofen, naproxen. When it is in excess, they can produce also kidney damage. We have some experience with some patients from Latin America country and other countries who have had the diagnosis of kidney dysfunction due to the estimated glomerular filtration rate that is decreased. Due to the use, during interview, we find that they have a lot of use and abuse of ibuprofen and other kind of drugs, cocaine, marijuana, alcohol, and other kind of illicit drugs, opioid, can affect the kidneys. Antiretroviral as acyclovir can produce also kidney dysfunction. Another important aspect for pharmacology, and this is a frequent question in Nclex, USMLE, the case scenario can appear, patient, for example, the age, and on the finding on the nurse note can appear that the patient have a urine color. First, we need to mention that our kidneys produce 0.5 to 1 milliliter of urine per kilo per hour. So this means that a patient that is 70 kilograms of weight produce 35 to 70 milliliter per hour. And this is most of the time the color of the urine, but this depends on other factors, as you know. the medication, the foods, the diets that we receive during any test, and the hydration or dehydration status that we have. This is the normal color. This can appear on the exam when say clear urine and when there is no presence of leukocyte or micro hematuria or hematies or blocks on the urine. This is not an aspect to follow in the patient. What we should follow, for example, a patient that have this color of urine, this means that maybe the patient have, for example, are on rifampin. Rifampin, remember, that is for tuberculosis, TB, and rifampin start with R and can put the color of urine red or orange, dark orange. Also, the rifampin, this condition of the color of urine is produced sometimes for dehydration. Remember, elder people more than 65 usually are dehydrated because they have the third reflex decrease, and they usually are dehydrated. We should recommend them to drink more water and to visit the doctor in case that they continue with this color of urine. Another color of urine that we should follow up in any nursing setting, we should discuss with the health provider. We should discuss with the multidisciplinary team. Is when on the exam we should check as one of the items that we should monitor in case that say that the urine is dark, red, or brown. When the urine is brown, is usually associated with some microhematuria. Hematuria is the presence of blood on the urine. It could be in relation to, for example, menstrual period, or in other elder people, we should rule out other conditions as cancer, medications, but it's an item that we should follow up on exam and in any setting in any patients. We should assess the patient for any kidney condition, any bladder condition, and any reproductive and urinary system conditions. Okay, those here you have some important aspect on medication that can affect the kidneys, how the kidneys are the important organ for the excretion, and another important thing, elder people. Elder people have decrease of the functioning of the kidneys because the decrease of nephron, the number of nephrons, the functional part of the kidneys are decreases to 40% to 60%. Kidneys function in elder people decrease by 60%. For this reason, it's recommended that elder people starting with prevention, alternative medicine, another kind of treatment instead of medication. In case that the doctor prescribes, after some tests, after some labs, after change of lifestyles, after changing lifestyle, recommended to follow this part of the treatment, we should follow up also the low dose on other people, because other people has, again, loss and function of the kidneys. Follow us on our YouTube channel, and we're going to provide 3 summary for all the content on pharmacology. And also we are selling this kind of a card on our website that is for Elsevier, and we have our own cards that we have a discount during this month for USMLE student, the student foreign physician, and also useful for pharmacology, who need to study for pharmacology. You have here the most important medications. There are some updates. For example, Nclex is a new medication that there are some research on Nclex on medication for diabetes, but the most frequent medication, group of medicine, appear on those kind of cards. Remember also that you can visit our website, dha.diverhealthsolo.com. Thank you, and you can contact us here to make an appointment for Zoom for any kind of review. Thank you.